Sorry about that. Nikki here with the San Diego Moms Blog. Just a few technical difficulties. As I was saying, I'm here with expert Sonia from Mother to Baby California. She's absolutely amazing, and we're here to kind of share some more information and resources with you guys in regards to fetal alcohol syndrome. September is Fetal Alcohol Syndrome Awareness Month. So without further ado, I'll let you introduce yourself and we'll start that over.
Yes, thank you so much, and great to be here and field some questions from the audience about alcohol use during pregnancy. Looking forward to talking with everyone who's able to join us. And I've been with Mother to Baby California for 18 years, and I field questions on our phone, email, chat about a variety of exposures in pregnancy. And today we're talking about alcohol use in pregnancy and the effects on the developing baby. So I look forward to talking with you. If you post any questions, it's a great time to do more education on this important subject. September is Fetal Alcohol Spectrum Disorders Awareness Month, and it was given this designation in September of 2015. And alcohol education is something that we do year-round. However, in September, we do extra activities to promote the message about alcohol use during pregnancy and the damaging effects that it has on a developing embryo or fetus. So this is such an important topic. Alcohol use during pregnancy is a leading cause of birth defects, and it's so important that women get educated about this. Men and women get educated about this topic.
Yeah. And I think one of the surprising things when we were kind of just looking through the amazing resources and things that you guys have online is that 50% of pregnancies are unplanned. And so it might not even be that, you're making the choice to drink during your pregnancy, whether, that is the case or not, but maybe you don't know you're pregnant, and maybe you don't find out till 2 or 3 months down the line. And maybe you could talk a little bit about that, because even, that's actually probably the most critical, almost one of the most critical times. And maybe just talk about kind of that and the...
Exactly. We were talking about this actually before we started, was that, in fact, over 50% of pregnancies are not planned. Alcohol is socially acceptable, so many people drink. It's legal. If you're over 21, it's easy to access alcohol. So if you're not planning a pregnancy, it's not unusual that you would have exposure to alcohol before you recognize that you're pregnant. In fact, one study found that something like 1 in 10 pregnant women reported drinking alcohol in the month prior. So this is not an unusual exposure, again, because it's legal, because it's socially acceptable, and because most pregnancies are not planned. In fact, many women can expect to have some alcohol exposure during pregnancy. And, ideally it would not happen. It's a source of a lot of confusion and even shame for some women who have this exposure. We don't want that. We want women to get educated and to feel empowered and to feel that they can make changes in their behavior and make positive, healthy changes in their pregnancy as a result of learning about alcohol use in pregnancy and how harmful it can be. So that's what we hope. We hope to educate women so that they feel empowered and that, in fact, they're making healthy choices in their pregnancy.
And let's say, if you find out you're pregnant and you had consumed alcohol during those first weeks, what are some of the steps, or what is the direction that you would give? Or
right. So if a woman finds out that she's pregnant and she's had some alcohol exposure, of course we would want her to stop drinking and then talk to her doctor about her concerns and to get more information. So a service like ours, Mother to Baby California, we can go over her dates, kind of identify how much exposure may have happened, because it's possible that she found out very early in her pregnancy, really early, that she was pregnant, and maybe it's less likely that the developing baby would have been exposed. But maybe she found out later, and maybe through our conversation with her, we can discover either other exposures that may have occurred, maybe additional alcohol exposures that have occurred that she may not have immediately been aware of. So we can talk about that. We can talk about potential risks or concerns, what we know from the studies, what we don't know. And all this is information that her doctor and she will benefit from, going forward in the pregnancy. But yeah, the message is not to drink once you know that you're pregnant, especially if you've had some alcohol. Don't assume that it's automatically devastating to your pregnancy. Please know that we're here to provide support and education, and we look forward to talking with you about it.
And that's one of the resources you guys provide. You can actually jump online and ask questions.
Exactly.
You can call in.
Exactly.
And it's completely free of charge. I mean, it's definitely just
Absolutely.
a resource.
The service here at Mother to Baby, we've been here for over 30 years providing education to pregnant women and women that are planning pregnancies. And yes, the woman can call us or can chat and send an email. All the information she provides us is confidential. And yes, our whole goal is education, research, providing information to pregnant women, empowering them with this information, and that's why we're here. It's a total judgment-free zone for women that are pregnant or planning, exactly, for any exposure that they're concerned about. Today we're talking about alcohol, but any exposure that they're concerned about.
Which that was one of the things I really liked about the site, is they definitely provided resources and other harmful exposures that, when I was pregnant, I would have loved to have had that resource. So I definitely think there's a lot of value in the site itself, and obviously to be able to have a live person that you can ask those questions to.
Exactly.
And I guess, too, if you guys have questions, please make sure you're dropping them in the comments. We'll be sure to address them. We'll also be posting links and kind of just follow up information in the comments as well. But I guess what are some of the common questions that you get when you get a call or a chat?
So I think one of the common questions is, can I drink? So women will say, hey, I've been getting some mixed messages. My friend said, that women, other women drink and their babies are fine, or women in Europe drink and their babies are fine. And one of our jobs is to clarify these kinds of myths that are out there. And it's not, any one person's fault. It's not about saying that it's somebody's fault that they heard this information from a well-intentioned friend, for example. But in fact, there is a huge problem worldwide with alcohol exposure during pregnancy. It's not a problem just in the US. This is a worldwide problem. And it's a complicated issue. Many times it's related to poverty. Very complicated issues worldwide related to alcohol use, cultural issues, much more complicated than we can get into in the nature of this discussion. But it's very important that we communicate to the public that hundreds of papers on the topic of alcohol use in pregnancy. What we found is that when women drink alcohol and they're pregnant, that alcohol enters into her bloodstream, crosses the placenta, and enters into the developing baby. There's no question about that. The question is how much alcohol, right, or how little alcohol does it take to cause effects on this developing baby? So we know a lot about very high levels of exposure of alcohol in pregnancy. So fetal alcohol syndrome is the name given to the most extreme, the most severe form of these birth defects related to alcohol, okay? We know a lot about that because those birth defects have been very well documented, and they're very severe. We know about that. We don't know as much about the very, very mild end of exposure. So, what about if a woman drinks once a week during her pregnancy, has a glass of wine, a beer, a mixed drink once a week during her pregnancy? We don't know exactly what effects that has. We have no reason to believe that it would be zero effect. We have no reason to believe that because we know that the baby that's developing is exposed. So the risk may be lower, but the risk would not be zero. And it's very important that we communicate that to everyone so that women are informed about those choices in their pregnancy. We want to communicate that there is no known safe amount to drink during pregnancy. Fetal alcohol syndrome is the most extreme form, but there are other clinical names to the effects of alcohol in pregnancy that are more mild. So some babies, would have more mild effects on their intellect or behavior.
What are some of the effects?
Yeah, so the most we start off with the most extreme because there you can talk about all of them. So it's with the most severe form, the fetal alcohol syndrome, it's prenatal and postnatal growth retardation, so refers to growth, physical growth in the baby. And then growth in the brain, so microcephaly, so small brain size. Features of the face and body that are unique to this syndrome. So short palpebral fissures refers to the eye slit space, a smooth philtrum, so smooth line between the nose and the upper lip, and the upper lip also was missing the heart shape. So a small head circumference. There are birth defects. Some people are not aware of the physical defects. So heart defects are seen more frequently in women who drink heavily. Kidney defects in their babies. Eye defects. Not surprisingly that you would see eye defects because obviously if the brain is impacted, then that impacts the eye formation. So eye defects. So these things are all with the most severe form. So problems. Anytime you're talking about problems with the brain, you're talking about problems with behavior, IQ, poor judgment. Long-term studies on babies, again, most impacted, show a higher risk of depression and drug and alcohol use and abuse. Incarceration in women that are impacted by alcohol prenatally, they grow up and more likely to get into sexual behaviors that are have adverse effects for themselves, and young men to end up in jail, incarcerated. So there's lots of long-term effects also from being impacted prenatally. So again, that's the most severe. At the most minor, you might see lower IQ, but not maybe as severe as you would see, obviously, with the most severely affected. So with the most severely affected, it would be an IQ less than 70 or 71. With the most mild, it might be a little bit lower, but not so severe. You might see some behavioral problems, some attention deficit problems, some issues with schooling, behavior, but you wouldn't see all of them because that's what you would see with the most severely affected. So the difficulty is with the studies, of course, is identifying these issues with the most mild levels of exposure to alcohol prenatally. So that's what makes it also difficult to communicate risk to women that we talk to on the phone or by chat. Is they tell us, hey, I had this amount of small level of exposure, and we really try to get into their timing of their pregnancy. Well, how many times did it happen, and was it very early, or when was it? And we try to really get into try to determine what the level of exposure was, how frequently it was, because that's all important in determining risk for us. Is not only how much did she drink, but how often did she drink. We ask questions about age and has she had another baby previously affected by alcohol. These are all things that we talk about when we're trying to assess the risk that an individual woman has about alcohol use in pregnancy and the potential effects on her developing baby. So we ask a lot of questions actually when we're trying to make an individual assessment for any individual woman who calls the service or chats with us.
Very good. Why don't we dive into some of the questions we have here, because we have a few. Stacy's asking, I've heard later in pregnancy is not as risky. Is that true?
Gosh, that's a great question from Stacy. So the baby's brain, as you know, is developing throughout pregnancy, and then it's developing for at least 3 to 4 years after birth. So because of that, there is no safe time to introduce alcohol, which is a neurotoxin. So it's anytime you're talking about neuro something, it's the brain, right? So alcohol can impact the baby's brain, and there is no safe time that we're aware of to introduce alcohol to either a baby that's developing or even after birth. Like we don't know of any time that would be okay. So right, so there's no evidence to say that you can drink later simply because the baby's brain is still growing.
That's great. And then Sarah, she says, have there been studies on when the alcohol would be an issue? For instance, Many women don't know, it's moving, when they are first pregnant, which is the most important development seems to take place, and we kind of addressed that a little bit earlier.
Yeah, so we'll talk about it again. So a lot of women find out that they're, thank goodness, right? Many women do find out that they're pregnant early. So they may be 2-3 weeks pregnant, they find out early. Maybe they were, they had some exposure to alcohol and they stop. And that's the best thing that a woman could do, is actually stop drinking. So then she calls our service, and what we'll do is we'll try to figure out when she became pregnant. So she'll provide us her last menstrual period, and we kind of go over the dates, try to figure out when these exposures occurred. They may have occurred very early, meaning around the time of conception. We can be actually a little bit more reassuring, because it does take some time for that placenta to form and to start allowing blood flow between the mom and the baby. So that is protective, because if the placenta is not really totally functional yet, or even allowing blood to cross to the baby, that is somewhat protective for the alcohol. So we really, when we're talking to women on the phone or doing the chat, or by email, even having a conversation by email, going back and forth, we're trying to identify when the exposure occurred in relationship to her conception date, see how early it occurred, because it might be that just simply because of the timing, we can be a little bit more reassuring. I hope that answers your question.
And maybe some of you guys can post in the comments, where do you guys think some of this misinformation and mixed messages are coming from? Is it media? Is it just maybe your aunt or your uncle? For me, it was kind of like my older aunts and uncles that maybe were like, oh yeah, just one glass of wine's fine a week, or whatever it was. Where are you guys seeing some of that? Because for me, when I became pregnant, it was just like a no-brainer. Whatever I can do to make sure that this baby comes out. Because I feel like there's so many other things that are out of your control, that are worrisome when you're going through the pregnancy thing.
Exactly.
That for me, it just didn't make sense. So, I guess I'm just kind of curious, and you guys can answer in the comments, and we'll pull up another question.
And there's a question about is there a certain kind of alcohol, right, or beverage that's more harmful? No, it's alcohol is alcohol. So whether you're drinking a mixed drink or you're drinking a beer, alcohol is alcohol. It's going to get into your blood. It's going to cross the placenta. So as long as it's alcohol and the woman is drinking it while she's pregnant, then it's going to cross the placenta to the developing baby.
And then breastfeeding, I think, is one thing, and I see Ashley has a comment here, and that was something for me too. I was like, well, I can drink it, I'm done. And then it was like, but then then there was just tons of, I feel like the information, when you Google it or when you start to do research, it's very confusing. And
so going back to, again, the woman drinks, whether, and this is males or females, if you drink, the alcohol goes into your blood. So if you look at a breastfeeding woman, what's in her breast milk is reflecting what's in her blood. So if she has alcohol, then that alcohol that's in her blood is in her breast milk. Then if she waits, that alcohol is metabolized from her blood and it leaves the breast milk. So to help that make sense. So it was in her blood, but as it metabolizes out, it actually leaves her breast milk, and then she can then resume breastfeeding.
Is there any safe, was it body weight? Is it time?
No,
or
we're not aware of that body weight, but it is time. It's 2 to 2.5 hours per drink.
Okay.
So if the woman has, it's just easier to think of it per drink. So if you have any beverage, 2 to 2.5 hours to resume breastfeeding per drink. So if you're going to go to a party and you may have more than, a couple of drinks, then you might want to pump your milk so that you're having some alcohol-free, we'll call it alcohol-free breast milk for your baby. And then when you return from your party, if you've had 2 drinks or whatever, 3, then you can actually wait that time. The issue of pumping and dumping might be more for your own comfort. So if you have engorgement, you would probably want to then dump that milk. But otherwise, just waiting the 2.5 hours, 2 to 2.5 hours per drink, then you can resume breastfeeding your baby again.
That's really good information. Let's see what else we've got.
Strips that test breast milk question. For alcohol. About the strips that test breast milk, that's something that I've not heard of. I don't know if that's something that's approved by the FDA. you'd want to check to see if that's actually been approved. Thank you so much for mentioning that, Annie. We'll actually, I think we just need to make a note of that, and maybe we can come back and post something on that, because I'd be curious.
Yeah.
I'd be curious as to whether that's an FDA approved product, and what kind of tests they did on that to determine that in fact it's accurate. So that's what you would want to know, is how accurate and to what degree. So that's a great question, and I want to definitely look into that. I didn't even know that such a thing was available. So thank you, Annie, for bringing that up, and we will check that out and hopefully get back to you on that and post something when we get more information.
Perfect. And then as far as breastfeeding, is there same thing? I guess I kind of want to go back to the guided information you guys have on the site. As far as, I know we're talking about alcohol, but other just exposures and things. Are there any other, besides alcohol, with breastfeeding, just kind of since we're on that topic, like that you still need to be really aware of? You know,
right, exactly. I mean, because the baby's brain is continuing to grow through 3 to 4 years, we definitely want to be proactive and get ahead. In this case, get ahead of the emerging science. There is no safe time to drink when you're pregnant. There's no reason to believe that it would be safe to introduce alcohol when the baby's brain is still forming, after birth. So anything women can do to limit any or prevent any type of exposure, that's really important. We don't want to interfere or discourage women from breastfeeding, and we don't want to women to feel that they cannot drink at all when they're breastfeeding. It's so important that we have this information about the 2 to 2.5 hours, because it does mean that you can drink when you're breastfeeding. It just means that you want to follow the guidelines so that you're not introducing alcohol to the to the baby. One of the things that one of the questions that still needs to be looked at, and I don't think has been looked at very well, is how alcohol, heavy drinking, maybe not light drinking, but how heavy drinking or even light drinking might impact the quality of breast milk. We'd actually, that really hasn't been looked at. But again, we would not want to discourage women that are breastfeeding from breastfeeding. Just keep in mind that the 2 to 2.5 hours per drink, and then storing some breast milk ahead of time if you think you're going to be drinking more heavily.
And then I have kind of just a note here, just for people, if you have anxiety or depression, can you take medication while you're pregnant or breastfeeding and kind of?
Yeah, so absolutely. If there are many women, in fact, that's one of the leading calls to our service is about antidepressant use during pregnancy. So many women that are, suffering from depression or anxiety or PTSD, any number of conditions, mental health conditions, do continue to take medication when they're pregnant. So, and on our Mother to Baby website, we have a fact sheet page. We would invite everybody to go to the fact sheet page and look at those under the medications section. We have a number of medications that are used for mental health conditions. Check those out. Share them with your doctor. If you're planning a pregnancy, plan ahead of time. Have that conversation with your doctor about what medications are the best studied for you to use and that are effective for you to use at the lowest effective dose during pregnancy. Definitely want to, if you're planning pregnancy, do that investigation ahead of time. But if you find out that you're pregnant, don't stop your medications for mental health conditions. Don't stop those right away. Call us, call your doctor, and because some of those medicines, it says on the label that you should not stop them abruptly, because you could actually either suffer a relapse of symptoms or suffer some side effects from the medications themselves if you stop them abruptly. So resist stopping those medicines for depression or bipolar or schizophrenia. Don't stop them right away. Talk to your pharmacist, talk to your doctor, give us a call, text, chat with us, and we're happy to provide you with information. Visit our website, download those fact sheets, get educated before you make any big changes. Because in fact, after discussing your medications with your doctor, after getting the information that we're able to provide you, it may turn out that it's better for you and your baby, your developing baby, to stay on your medications. Some women may be able to go off their medications, but a percentage of women will be better, healthier during their pregnancy taking their medications.
Right. And then one question I just kind of have, so we're at the Center for Better Beginnings here at UCSD. So I guess part of what they do is it's a program for education, screening, and research for children who were exposed to alcohol during pregnancy. And so, for example, let's say you were had a few glasses of wine, again, early in pregnancy, nothing on the extreme side. What benefit would come from getting your child screened, just to is it just to rule it out? Are there things that can be then redirected?
Actually, it's actually wonderful to get involved with the Center for Better Beginnings. It's the education, but also the fact that they can actually look at your baby if they think that your baby needs to be examined. It's a great place that all the experts are there for you. If you've had alcohol exposure in pregnancy, your baby's already born, definitely we would recommend giving them a call. If you have any concerns, they have all the experts available to refer you to testing if that's needed.
Okay.
They will determine that. They will discuss it with you. Everything's done with of course, your participation. You are driving that discussion. You are driving that those decisions, and you're making those decisions along with the experts at the Center for Better Beginnings.
We have a good question here. Thank you for that answer. That was
Yeah.
good. So Lynette is asking, if you consult your physician and they say it's not a problem to drink a glass of wine or two during pregnancy, what would you recommend, maybe your conversation with that doctor?
Yeah, I definitely, if your doctor says that it's not a problem to drink, definitely ask them for the research behind that. Because doctors, do make recommendations based on the evidence, so based on the published studies. And there is no evidence that says that drinking every week during pregnancy has zero consequences. So if your doctor was to mention something like that, please ask them feel free to ask them what is the evidence for that, and then come back and share that with us if they're able to provide it. This is your pregnancy. I know you want to make the healthiest choices for your developing baby, your developing baby's brain. You don't want any concerns long term that maybe a decision that you made would have had some harmful effects. So definitely ask for the evidence, come back to us, we're happy to check it out. Again, I don't think that they would be able to provide any evidence because there just isn't any that says that drinking any amount is safe.
And that's something, I think I feel like I had those conversations. And same thing too with medications. I feel like one of the things my doctor said is, to you is the benefit more than the risk that it is for your child. And as a mom, you're like, I don't know. I don't think there is anything. Obviously, you have to stay on the medication. But for me, it was, no, the risk does not outweigh the benefit
Exactly.
of something when you're talking about, obviously, your developing child.
Exactly. I mean, women that call our services are so concerned about everything. I mean, pregnant women agonize about everything, even when they're suffering from nausea in pregnancy. We get so many questions from women who are suffering terribly from nausea, and they're just agonizing over anything that are recommended even by their doctor. The doctor may say, hey, you should take this for your nausea, and women really struggle with that. So we recognize that women really do want to make healthy choices during their pregnancy, and we want to support those choices with evidence, definitely.
Why don't we talk a little bit about 9 Months Matters? That's the awareness campaign that's servicing us here and why we're here today. But maybe you could share just a little bit more how all of these different organizations come together as one.
Yes, well, the 9 Months Matters, certainly it's a great way to describe it, that all 9 months matters and for the developing baby, meaning there's no time in the pregnancy when alcohol can be introduced, where there's where there would be zero effects, where there would be a safe time to drink. So definitely it's a great campaign to inform and educate women about the importance of avoiding alcohol, of abstaining throughout the entire pregnancy. And so you have our service at Mother to Baby that's providing the education. You have the ongoing campaign to educate women year-round about the importance of abstaining from alcohol during pregnancy. And then you've got the Center for Better Beginnings that really takes up where Mother to Baby California leaves off, where once the baby's born, they can take over if the baby was exposed to alcohol. So it's the prenatal, it's prenatal, pre-pregnancy, and then prenatally providing education. That's Mother to Baby. After the baby's born, if there's alcohol exposure, then Center for Better Beginnings, and then of course you have the branch of education, the 9 Months Matters, that's year-round, explaining and educating women about the importance of alcohol, of avoiding alcohol use during pregnancy.
Any other questions? Oh, here we go. We've got a question from Daphne. What about the impact of drinking during the first trimester before you realize you're expecting? So I think we kind of addressed this one a little bit earlier, but maybe just touch on it kind of briefly.
Absolutely, yeah, we'll talk about it. Yeah, so this is a major issue because if there's going to be alcohol exposure during the pregnancy, for the average woman, it's going to be in the first trimester before they know that they're pregnant. And it's very critical, I think, that women find out as early as possible that we're pregnant, because then we can stop, whether it's alcohol or any other exposures that may be harmful. So yes, it's very important that we find out early. And yes, most women that are drinking, it's probably going to be in their first trimester. It's unlikely somebody's going to start drinking in their second or third trimester. They're most likely it's going to be in the first trimester. A lot of the research is with first trimester drinking. Again, we're concerned about that. The risk is related to how much you drink and how long you drink, as well as other factors like your age, whether you've had a baby previously affected by alcohol, might be genetics. There's also research looking at genetics, how that impacts the risk that a baby would be born affected by alcohol. So lots of factors that we look at when a woman calls us and says, or chats and says, hey, I drank before I knew that I was pregnant. Lots of information that we collect to help her by providing her the best assessment of risk that we can, with all of the knowledge that we have available. And granted, we don't have all the answers that we would like to have. There's still a lot that we don't know, but with the information that we do have, again, we are able to provide a better risk assessment when we're able to communicate with the woman about how much she drank, how often she drank, how long into the pregnancy. We're able to gather more information and provide her a better risk assessment.
And then Daphne's asking, has the rate of the fetal alcohol syndrome dropped as awareness has increased, or is it still a major issue?
It is a major issue because, and again, it's complicated. It's a major issue because more, women drink in parts of the world where maybe they didn't drink before. The standard of living, again, this is a complicated issue, but the standard of living may be increasing in areas that are becoming more urban. And as they become more urban and a little more affluent, women go to work, they have then access to alcohol. They may not, and alcohol drinking and other kind of Western style parties where they didn't have that before. This is not an issue of good or bad or nothing. I don't want anyone to get that impression from what I'm saying. It's just that it's not just about awareness. It's about education. It's about everyone coming on board. Male partners, governmental organizations, medical societies, everybody coming on board, supporting women who choose not to drink when they're pregnant, supporting an environment that encourages women not to drink even if they're planning pregnancy. So if you are in an environment of women and men and a society that says, hey, you're planning pregnancy, better to avoid alcohol because you may become pregnant and you're not going to exactly know the moment that you become pregnant. That kind of society then will see, I imagine, would see a decrease in alcohol-exposed babies, but we're not there yet. It really requires, again, everybody coming on board, males, girlfriends, the medical, societies, the government, everybody coming together, supporting women, women's choice to abstain from alcohol during pregnancy, and even when they're planning pregnancy.
Exactly, great. Any other questions or anything kind of before we wrap it up here? Just wanted to, maybe we can drop some of the links from the mother to baby, like the resources, where they can go to chat. We'll put those in the comments. Does anybody have any other questions or concerns or anything they'd like to kind of address here? I know I learned a ton. I definitely think there's a lot of things, like I said, that I wish that I had known, and definitely when thinking about having more kids, I think that those will definitely just be more prevalent.
Absolutely.
Planning and preparation.
Absolutely, yeah. I mean, I think it's all the studies, the research is always evolving, especially on alcohol. It's something that's of great interest worldwide. It's of interest. I had mentioned before briefly that we had talked about myths surrounding alcohol use in pregnancy. That there are people that hear from friends, hey, there's women drink alcohol in Europe, for example, and they don't have babies with fetal alcohol syndrome. And I want to address that right away. I don't think I addressed it before. There are lots of babies born all over the world, including in Europe, that have fetal alcohol syndrome or that are affected by alcohol exposure in pregnancy. They may not have the full fetal alcohol syndrome, but they may have parts of the effects, learning problems or emotional problems or related to the alcohol exposure. So this is not something that's unique to the U.S., not unique to any specific culture. It has to do with the alcohol. So when you introduce alcohol into a pregnancy, that's when you start to increase your risk. And it doesn't matter where it occurs, whether it's in Asia or in Western Europe or Eastern Europe or Africa. That does not matter. What matters is the introduction of alcohol to what would be a normally healthy developing pregnancy. What we would expect to be a normally healthy developing pregnancy is now exposed to alcohol and is now at risk of fetal alcohol syndrome or one of the more minor effects from the alcohol.
And then Daphne's also asking, are there any books or classes? Obviously you have your website with all of the resources and stuff there, but are there any in person? Maybe people learn better coming in to meet or doing a class or...
Yeah, well, there are actually on our website. There's there are the fact sheets, and then there's blog articles that you can check out, and we would be happy to actually post some books, and I believe there's a couple films that you might be able to check out. So Daphne, when I get back to my desk, I'll send those over so we can post those for you, so you can actually hear firsthand accounts from people that have actually were born with this condition, and they can talk about it. Firsthand accounts, that's really important. And actually books that you might, or brochures that you might be able to get more information on. That would be great. Thank you for suggesting that. And we'll definitely follow up with replying to that and sharing with that for everyone to see.
Perfect. Well, thanks everyone. Thank you so much for your time today.
Well, thank you for having me.
So educational, and thank you everybody for being here. And we'll definitely get this video up on YouTube, and we'll be able to reshare it so you can refer back to it. Obviously, if they missed the live, they'll be able to see it at a later time. And yeah,
Thank you for the great questions, everyone.
Thanks everybody. Appreciate it.